Hi, everybody, and welcome back to my latest episode of Mrs. Mummypenny Talk, the big questions. And I am sat with my latest guest, which is the very wonderful Becca Donovan. And we are very excited to talk about the big question this week, which is all about therapy. What is the point of therapy? Why do I need therapy? Why should I even consider it? And Becca's an absolutely perfect person to talk about it because she is a therapist. And I heard about you from a fellow podcaster. I think you were on his podcast on Sammy's Up the Games podcast. And he was like,
Yeah,
Lynn, you have to meet this person, Becca. You will absolutely love her. So that's how we've joined together. And now I've got you on the podcast and I can't wait to talk to you.
I am so excited to be here. Thank you very much for having me.
Yeah. So therapy is something that I am really passionate about and have had therapy most of my adult life. So, and it's something I always say to people when they're having like a little bit of difficulty, friends or colleagues or whatever, like maybe consider some therapy, but it's something that
hmm
people are scared of. And I
Yeah.
don't want them to be scared of it. So that's why I wanted to bring you in and
hmm
talk about it openly. We'll be talking a lot about personal experiences. But yeah, just about the whole concept of therapy. So before we delve into the detail, start with
Yes.
you, who you are, where you come from, and why you do what you do.
Yes. So, just to be super clear at the beginning, I am currently a psychotherapist in training. So, I want to just be very clear about that before we start. I am also a certified coach as well, which was the main reason that I actually ended up going into training to be a therapist. So, I'm in the middle of my training at the moment. And so, part of my world, I'm very much in the marketing space, which is very interesting because actually a lot of it is to do with human psychology and being able to speak to people on that level. But I have had about 10 years of therapy myself personally before I decided to go on this journey. And it was lockdown, as it was for many people, that completely transformed everything for me. Went through a hugely turbulent time personally with separating from my children's dad, and just had one of those moments of being like, okay, what the hell am I actually doing with my life? What do I want to
Yeah.
do once the world goes back to normal? So I found a coaching certification course to do, and I'd always thought about wanting to do therapy, but it is expensive to train. To retrain as somebody who already has a degree, who's already been and done all of that, it's really expensive to retrain and do it. So I needed something to dip my toe in to make sure that it was the right thing for me, that actually my gut feeling about this being what I wanted to do was right. So I did that throughout lockdown, and that was the tick of the box of saying, yeah, helping people get in touch with what is going on and figure out what it is that they want and actually start to see and make real changes in their life gives me an intense amount of satisfaction. And that then started my journey to retraining alongside my normal adult job.
So, all right. So you're actually doing your marketing job and doing this alongside. That's
Yes.
immense. That's a lot.
I'm not one for just having one thing going on at once. As anyone who knows me will tell you, I tend to have like 5 different things that I'm doing all at the same time.
Yeah. And also whilst you're training to become a therapist, you have to be in therapy
Yeah.
as well, don't you? Because
Yes.
correct me if I'm wrong, but don't you have to have like 100 hours of your own therapy?
Yeah, you have to do your own therapy. You have to do hours of practice therapy, being a therapist to other people. There are having to do that, and it's interesting because I think sometimes people will be put off the idea of going to train to be a counselor or a therapist because they then have to go into their own therapy, which I think is such a shame when people do that, because I'm like, actually, it allows you to put yourself in the shoes of your clients, patients, however you want to talk
Yeah.
about them. And it's really difficult to put yourself in their shoes without having actually been the person sat in the chair. even if you've not got like a huge amount of trauma, capital T trauma, that you need to figure
Yeah.
out, just being the person sat in the chair and experiencing what that feels like makes you a 10 times better therapist than without that.
Yeah. Yeah. And are you an empathic person? Like, because I've spoken to a lot of psychologists, and sort of why did they become a psychotherapist? Because a lot of people I know have become psychotherapists later in life, and
Mm-hmm.
they say to me it's because um, they've often had just a lot of people just share their stories with them, like
Yeah.
unwarranted, like, because I'm an
Yeah.
empathic person. And like, even I'll be walking down the road. I was walking down the road in London yesterday, and this guy came up to me and he was like, I have to tell you what this cyclist has just done to me. I'm like, why are you coming up to me? And I just don't know why this happens. But yeah, are
But
you that
that,
kind of person?
yes, 100%. The amount of times that people have said to me mid conversation, I've never told anyone this before. And I'm like, I hear that a lot.
Yeah,
Yeah.
yeah,
And I think I am an empath, like an empathetic person. I tend to have, and this is a good thing and a bad thing. It's a blessing and a curse, and I have to be really conscious of my
yeah,
introverted versus extroverted tendencies. I need space away from humans and stimulation to recharge myself, because I get really affected by the energy of other people. If someone comes in a bad vibe,
yeah,
I'm like, oh, okay, I need to manage myself in this situation. So, which makes me very good at what I do, but it also means that I have to be very careful about how I spend my time and not exposing myself to other people too much.
yeah, yeah, definitely, definitely. Okay, cool. So, right, I think where I want to start is because
Mm-hmm.
I've got loads of questions, but I'm going to jig around the order of them a little bit. Is because this is something that a lot of people ask me, is what is the difference between counselling and therapy? Because I've been in both, so I don't know if I do know the difference between them. But what's the sort of the
It's
how?
basically, it's the amount of training the person has had. So
Okay,
if you are a counsellor, so for example, you do less training to be a counsellor than you do to be a psychotherapist.
yeah,
So less qualified is a bad way to say it, because they're not. It's just a different amount of training that you have to do to be able to do it. So that's the difference. Because
mm,
with psychotherapy, for example, you will tend to then go and specialize down a certain route and be able to offer services that you cannot offer as a counselor, because you don't have the necessary training to be able to safely do it.
yeah, yeah, and counselling is quite a light touch, isn't it?
Yeah.
And this is just from personal experience here, because I did well, as I say, I've dipped in and out of therapy and counselling my whole life, but I did dip into counselling a little bit last year because I got some free counselling included with my income
Mm,
protection insurance, and I
mm-hmm.
thought, oh wow, this is a really great benefit. So I just tried it out, but I actually had quite a negative experience with it
Oh, interesting.
because it was too light touch. Because
Yes.
the kind of stuff that I mean, I've got quite a lot of trauma in my life, and
Yeah.
which I talk quite openly about parents dying, and when I was young,
Mm-hmm.
and divorce and all these kind of so counselling just wasn't enough for me. So the few
Yeah.
sessions of counselling I had, I was literally like, what is the point? This is not
Mm-hmm.
giving me any coping mechanisms, any
Yeah.
tools. It's just literally having a chat to somebody. So,
Yeah.
but that's
Which is enough for
fine,
some people,
which is
which is
enough.
enough. And honestly, counseling can be such a perfect way to dip your toe into the world, because
Mm,
even if you know you've got a lot of shit to deal with, going to speak to a counselor and just getting into the habit and getting into that comfort space of, oh, it's safe for me to open this box. Because from personal experience, when I initially went into therapy, my trigger point was one of my best friends committed suicide. And
well,
all of a sudden, I'd never had to deal with grief of that size before. And it hit me like a train. And all of a sudden, I realized oh my God, I have no idea what I'm doing. Like, I don't know how to do life. I thought I was
Yeah.
untouchable. All of these barriers that I built up as a kid, because I do have quite a chunk of childhood trauma in different forms. But I'd built up these huge barriers and I thought they were going to be the things that protected me forever. And then they were completely destroyed by this event. So I went to speak to a counsellor. And I remember going in and feeling like, once I open Pandora's box, I am terrified that I am never going to be able to close it again. And
Mm,
that is a very, very, very normal feeling. I'd probably say that every single person who goes to therapy, no matter how experienced they feel like they are or how prepared they feel like they are, that fear of opening the box and not being able to close it again is totally normal. And just go, just go and like peek in.
yeah.
It's fine.
Yeah. 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 And also like if you've got quite a few boxes that you've maybe
Yeah,
nailed
just
shut for like
nailed shut. You've put it
that
in the loft. You don't want to have to go back
insight
up
into
there
my
and
mind.
yeah.
Yeah. Yeah, but like I think sometimes like you might have with close friends, you might have like maybe often drunken conversations where like
Mm-hmm.
the boxes are opened a little bit, and it's almost like because I've got plenty of friends who talk to me about this kind of stuff, and I'm like, I'm not the person you need to talk to about this kind of stuff because I'm not qualified to help you sort out the grief to do with your
Yeah.
mum or
Yeah.
somebody who's dying and all these traumatic stuff. So yeah, I think yeah, everybody needs therapy.
Well, everybody does need therapy. And I think the reality of the world that we live in now is that counselling, like I said, can be totally enough for some people who just don't feel like they have someone to talk to, that they don't feel like they have
Yeah,
their
that's true.
community, that they don't necessarily have a family that they feel safe to communicate these things with. That is the reality of the world
Mm,
that we're living in. So counselling
mm,
holds such like importance in being able to fill that space. And then if you go to counselling and actually it isn't enough, it's not doing
mm,
what you need it to do, then yeah, look for a therapist who specialises in the things that you need to deal with.
mm.
But it can be such a great way to just dip your toe in and realise that it's safe for you to go and talk to somebody.
Yeah. So this is a massive subject, but can you like sort of share some of the different types of
Yeah.
therapy there are out there? Because I know I've tried probably about 10 different types.
Yeah, there are so many different types. So I will just kind of cover like a few of them. There's
Mm,
cognitive behavioral therapy, which probably everybody has heard of, and
yeah.
you may have been offered that on the NHS, and whether you're not,
Right.
or whether or not you've had a great experience with it or not, which is basically like focusing on identifying and changing negative thought patterns and behaviors. And it tends to be very structured, very closed in a certain period of time that you'll do it for, and then that's kind of it. Um, that can work very, very well for some people. It did not ever work for me, and I'll go on to
Mm,
that in a bit. But you will have
mm,
one of the things you might see when you start to look for a therapist is person-centered therapy, which is basically just focusing on the person that you're speaking to. So focusing on the client and being guided by them and their needs. And then as a therapist, being able to look in your toolkit of different things that you have learned over the years, different theories that you've worked with, and being able to pick up a theory and seeing if it works with that, with the client, um, doing some work on that and maybe transitioning onto something else. There's dialectical behavior. I've got notes next to me because I can't ever remember the full names for everything.
yeah, I don't blame you.
Dialectical behavior therapy, which is a form of CBT, but this is particularly for treating certain personality disorders, other emotional regulation issues. It is slightly different to CBT, but works alongside it very, very well. There's EMDR, which I am currently going through at the
Oh
moment, which
yeah.
stands for eye movement desensitization and reprocessing, which is primarily used for trauma and PTSD, and it helps reprocess memories that you have about a certain event, and essentially works like you work through it and it sort of takes the emotion away from the memory. So you can then
Yes.
afterwards, you may still have the memory, but you won't have the emotional attachment to the memory,
Mm,
which
mm,
honestly is actually changing my life. I
yeah.
can't, I can't believe how incredible it is.
Mm,
There's psychodynamic therapy, which explores like unconscious processes, past experiences that influence present behavior, which is pretty much all therapy.
mm,
So you will tend to find when you start looking for a therapist that they will list out the things that they specialize in.
yes.
More often than not, most therapists will be experienced in all of them to some degree. EMDR not so much. I think you have to go and like specialize in that. It's extra training that you need to do. But throughout your training process, we get taught about all of these things anyway.
Mm, mm,
And then we can just kind of, so for example, for me, when I go into being a therapist, I will basically be training in as many different things as I can to be able to be really, really person centered and just pick things out of the box that the client
yeah.
needs.
And then you just match
Yeah.
the strategy to the person and their specific needs.
Yeah.
Yeah.
And what I would
Um,
say is anyone, because it can feel quite overwhelming
yeah.
knowing what all the different types of therapies are and being like, well, I don't know which one I need. I don't know which one's going to work for me. What I would say is, and I know we'll talk about this, about how to find therapists and stuff, is take the vibe of the therapist above everything else. If you,
Yeah.
it's like dating. Like you have,
Essential.
the relationship between therapist and client is primary. It's key. That is more important than anything else. So
Mhm, mhm,
take that relationship, take the vibe with the therapist, because you are going to be opening up things and trusting this person with a lot of stuff, some stuff that you may
mhm,
never have literally spoken out loud before. So you
mhm.
need to feel safe with the therapist first.
Yeah, yeah. And every therapist will offer you like a free sort of
Yeah.
intro session so you can pick up on that vibe straight
Yeah,
away.
and they might do it. They might just have like a consultation session where you just have a 30-minute chat with them rather than like
Mm,
a full session. Each
yeah,
therapist has their own way of doing things, but you will
mm,
always be given the opportunity to make sure that it's a good fit for both of you before you start diving into anything.
yeah. And so this is a really important subject to touch upon is cost of it. But if
Yeah.
you're if you go to the doctors, because I've done this, if you go to the doctors and say I'm depressed and I need some help, very flippantly said there, but they will generally refer you to a counselling service,
Hmm.
the light
Yeah.
touch, and maybe you'll get like 6 sessions ish. But as we know, the mental health system services in this
Is
country
a
is
rubbish.
rude. So
Yes.
waiting lists vary by, each geographical area, but it can be a year, it can be 18 months, it can be 6 months if you're lucky, but you're going to have to wait for it. So I always say, if you can bloody afford it, just
Yeah.
pay for therapy and remove
100%.
yourself from the system that is overflowing with people waiting for it. If you
Yeah.
can, if a counselling session is probably going to cost, I'm going to say like 40, 50 quid an hour. A
Yeah.
therapist session, my therapist is 120 per session.
Yeah.
Therapy is
My
normally
EM
double counselling.
Yeah, so my EMD, and it also depends on where you are. So, like up north, it is
Yes.
cheaper. So,
Yeah.
my EMDR, which is more expensive because it needs more supervision, is £105 a session. And I know that just psychotherapy will be less than that. Typically like 70 to 80 quid up north, but it
Yeah.
depends. It depends on your location. It depends on the qualifications of the therapist, because the more
Yeah.
qualified they are, the more they can charge. It does really vary. And yeah, what I will say is, this is your life that you are dealing
Mm.
with. Sacrifice something else. You don't have to go into, oh, well, I'm going to have to pay for this forever. You don't have to do that. If you show up and you do the work and you can only afford to do 6 to 8 sessions with a private therapist, those 6 to 8 sessions, and then take a break until you can afford to do it again, you can do that. That's totally fine. But do it. Find a way to do it. Do not wait, because it's not worth it. And unfortunately, the NHS therapists are overwhelmed. They're overwhelmed, they're overburdened, they're not working necessarily in the safest and best conditions. Private therapists have way more control over their schedule, over how many patients they see. It's 100% the best option. Find a way.
Yeah. And it's like most people have no qualms as to paying like 70, 80, 100 quid a month on a gym. Well, like I and what I'll say about frequency of sessions as well, because it does link on to what you were saying. I've fallen into crisis times where I've reached rock bottom, and then I reach out to my therapist and I'm like, Jennifer, right, I need help. And then I'll have like a session every week with her for like a few weeks. And she's like, Lynn, we can't do this anymore. She's like, you just need to have one session a month. And I've made up my mind, I can afford that. I'm very lucky and privileged to say that, but also I need to for my, my mental health and all the stuff I've been through in the past, all the stuff I'm going through now. But she's like, it's trying to keep on an even keel, because when you're in the ups and downs that life inevitably takes you in, it's so difficult to get out of the downs, and it's like you can't grasp onto that therapist. It's just much easier if you sort of space it out.
100%, because also what you are doing by keeping yourself what you are doing if you wait until crisis moment is you are keeping yourself in that cycle of behavior, and that is the cycle of behavior that you want to get out of. You want to be working towards allowing yourself to be way more steady rather than peaks and troughs. So whatever consistency you can afford, that is better than waiting until the crisis moment and then just having 3 or 4 sessions and then dropping off again, because it's not actually going to help you make any long-term change.
Yeah. And so I think it is probably worth sort of sharing a little bit of the reasons why I started with therapy. Because we've sort of touched on if you have big trauma events and if you don't. But the thing is I was at an event yesterday in London, and one of the sessions was on life events that happen to you, and it's a room full of like all different aged people, and these people on the stage were talking about, there was one guy who'd lost his husband, there was one woman who'd had a baby die at full term, there was another person that had gone through like massive mental health issues with their partner who'd nearly died, and it was such honesty from this panel. And we just sort of, my friends and I sort of turned to each other like, literally, everybody goes through some kind of trauma, particularly when you get to like, 30s, 40s, or even like, I had traumatic events happen in my childhood. So we are not built to cope with these traumatic events without help. And that's where big mental health issues, come from, or needing to rely on medication and all these kind of, external sources to try and help fix us, where I just think like have and also with like relationship counseling as well, like they do say you should have that before you have the problems with your relationship to almost like prepare you for it. So I just can't see a time that you wouldn't go to therapy. I just can't.
Yeah. I mean, I could talk all day about the need for couples therapy. So when I am qualified, I want to specialize in couples. I also want to specialize in neurodivergent therapy, because
Brilliant.
this is a whole nother tangent, but I am neurodivergent. And I have very close friends and family members who are female, particularly, and autistic. Only recently diagnosed autism, but obviously now looking back, oh yeah, you've definitely been autistic the whole time. And as a neurodivergent person and experiences with that, the traditional models of therapy are built off neurotypical responses and behavior. And actually, I think a lot of the reason that some of the therapy hasn't worked for me is because it works for a neurotypical brain, but not a neurodivergent brain. So I'm very interested in researching and figuring out, okay, what works for neurodivergence and what doesn't and why, and particularly within couples, because I think there are so many men and women who are undiagnosed neurodivergent of a certain age group, and they are struggling in couples not only because they've had childhood shit that they've not dealt with, they've got attachment issues that they've not dealt with that they're not aware of, but also one or both is neurodivergent and the other person doesn't understand how to communicate with that person, and that can cause a lot of the problems. So yeah, what I remember, because I've been in couples therapy with a previous partner as well, and we were engaged at the time, we were going to get married, and she said, she was like, I just wish everybody would come before they got married, because number one, you'd solve a lot of problems before you get married and you still choose to get married, or number two, you don't get married because you figure out you're not the right people for each other. And luckily I was in the part of we didn't get married, and which saved me having to go through an inevitable divorce on the other side. So I could talk about that all day, but that's a different tangent. Particularly to do with money and couples.
Oh my gosh, yeah. Like I didn't do that therapy before I got married. We did the therapy when we'd reached crisis point, and it was too late by then. And
unfortunately, yeah.
What causes a marriage to split up? Money was a huge part of it, really, and communication. If we could all just communicate with each other and knew how to communicate effectively with each other, there'd be no problems in the world.
And unfortunately, I think, and it's nobody's fault, and no one's necessarily doing this consciously, but for a huge percentage of couples, you're still communicating with each other as injured children. You're not communicating with each other as healthy adults. And you think you are because you're in an adult body with an adult job and you do all of your big people things, but you're still kids. If you've not dealt with your childhood trauma, you are coming at each other like children. And how do children fight? It's always emotional. It never makes sense. It's not rational. And we think we're bigger than that, but we're not.
Yeah. Can I ask you, I'm going off topic now. Can I ask you about sort of psychotherapy for children? But particularly children with sort of neurodiversity things going on.
Yeah. I'm not sure how well I'll be able to answer, but you can ask me.
Yeah, it just feels, and this is from personal experience. It just feels like a lot of things are thrown at children
so
to
much,
sort of
too
see which
much.
one fits, and it's too much. But how do you? It's just I guess it's the same for adults with neurodiversity issues as kids. Like, what kind of therapy actually works the best? It's just really.
And I think there's a number of different layers to that. I think so. I have two kids. I have a 10-year-old and a 4-year-old, both boys. And my eldest he's not diagnosed with anything. He definitely is neurodivergent though. Because I see a lot of stuff in him that is in me. And I think part of the issue is a lot of the frameworks that therapists are having to work under again are from an older time, from a different time, neurotypical based, all that kind of stuff. But then also it's like I think it's a really great thing that things are being picked up earlier, kids are being given support earlier, because then hopefully, especially with thinking about having young boys, that I'm going to be raising young men who can actually be healthy masculine men rather than projecting all of their trauma onto the women or partners that they choose to have in their life. I've lost my train of thought. I can't remember what I was going to say.
Yeah, talking about children and the type of therapy that helps them if they're neurodiverse.
So I think it's really great that there is support and offer and being there in the earlier stages, but also the tendency to want to diagnose as soon as
Yeah.
something is spotted, the amount of things that are being thrown at them at an earlier age
Yeah.
anyway that they are
Yeah.
having to deal with, I'm not sure what the right thing to do is in that
Yeah.
space personally as a mum.
Mm,
Of
mm,
I don't necessarily want to overdiagnose my son. Like
yeah.
there are definitely extras. There's definitely extra support that he needs. There are things that we're going to have to do differently for him, but I don't necessarily want to give him a label that then makes him be perceived externally before somebody knows him.
Yeah.
Teachers,
Yeah.
for example.
Yeah. Yeah.
Um,
Yeah. 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 Yeah.
and just
And
there's so much stuff that they're
like,
being thrown at.
yeah. And other children at school, and like,
Yeah.
when you're at school, nobody wants to stand out from not nobody, but most people don't want to stand out from the norm. You just want to sort of blend in. Like, that's why you
Yeah.
see, all kids wearing black coats and, the same
Mm,
loafer shoes. Because this is what my kids do. I've got three boys. And they don't want to stand out from the norm,
mm,
because that makes other things happen. But
mm-hmm.
yeah, it's just, I mean, it's probably another podcast. I need to talk to somebody, with maybe with some kids who have
Yeah.
actually battled through the system and had
Yeah.
some kind of
That's
positive resolution, because I'm not hearing anything positive about it at the moment. And
no.
I know there's a lot of people talking about it, but
Unfortunately, I'm not hearing anything positive about it either.
no.
But yeah, the people in the trenches doing that at the moment, I have a huge amount of respect
Mm,
for what they're
yeah,
having to deal with.
yeah, 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 absolutely, yeah. So so right, let's go back to so you're listening to this podcast and you're thinking, yeah, okay, so Becca and Lynn have been through lots of therapy, and
Yes.
it's helping them out. So maybe I am going to give it a try. How do you go about finding a therapist?
Mm-hmm. So I've
And we've already touched on the sort of type of therapy, and you go for the vibe, but how do you choose the right, or how do you even find a therapist?
Yes. So obviously you can go through the NHS, which is, I'm not going to advise that being the way that you do it. But if you want to go and speak to your GP, they also might have information about private therapy as well. So I wouldn't completely discredit it. I have
Mm,
always used the counselling directory, which is
right.
literally just a dating site for, it's a directory of counsellors and therapists. And you go
Oh,
through their profiles and you pick a profile that you like and you get in touch with that therapist. That is where I
mm,
would go if you are completely new to all of this. Obviously, there are lots and lots of therapists now on social media, which I think is
yeah,
great, but you just have to be more confident in your ability to vet their credentials and vet them as a therapist. But it can also be a really great way to get a sense of their vibe. If they
yeah,
present themselves on social media in the way that they are as a therapist, then it's a really good way to just get a test of whether you think you're going to gel with that person, and then just contact them on Instagram or whatever that way.
mm,
They are the two places that I would go. I know that there's every chance that people who are interested in looking at therapy have probably been advertised BetterHelp. Um,
yeah,
Personally, I have heard many bad things about the company. I don't use it. But I have not necessarily heard the best things. And
mm,
again, I am not 100% certain that on the vetting process of people that sign up to be a therapist or a counselor on BetterHelp. So you can do it. I don't personally recommend it. I would go down the counselling directory route because that's
mm,
what I've used and that's what I know.
yeah, 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 I agree. I've read similar articles not being that great about BetterHelp. Um,
Yeah.
I don't know whether it was sensationalized though, to be honest. I haven't seen the other side, so it's a difficult one.
Potentially, but also I think, again, I could be wrong with this, but I think it might be like a subscription model as well, which
Yes,
is
it is.
not
It is.
it's not necessarily the most uh, affordable way to go about it,
Yeah.
depending on where you live as well. You might be in an area where actually getting a counsellor or a therapist once a month would be significantly cheaper than signing up to something like BetterHelp. So
Yeah.
I just don't
Yeah.
think it's the way to go.
Yeah. 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 Because yeah, then you forget to cancel the subscription. Then it's costing you like
It's a whole
£1,000 a
nother
year.
thing.
Yeah.
Yeah,
Yeah.
exactly.
Going
Let's
back
not
to
do
my
that.
money, personal finance side. Yeah. So also um
Mm.
like recommendations from friends as well.
Yes.
Um because so my therapist is so I Zoom with her because she lives in Scotland. So gone are the days where you have to be sat in front of somebody.
Mm-hmm.
And she specializes in therapy with women who have been in narcissistic relationships.
Mm-hmm.
So she's very niche, very, very niche. And she also specializes in neurodivergent children. So she's gone down, two really interesting routes. And she has been my therapist for 4 years. I would never go to anybody else.
Mm-hmm.
Um, and she, you described the uh, what was it called? You use the 4-letter acronym one, the A.
EMDR.
Yeah. So she
Yeah.
uses she's a human givens therapist for a start, but she does use that methodology where we've worked on a lot of sort of trauma events from my
Mm-hmm.
um life, and she's very cleverly removed the emotion from those situations.
It is magic.
Um it is magical, and
Yeah.
it can be really quick as well,
Yeah.
like
Yeah. Mm-hmm.
and it's often used on ex-soldiers with
Mm-hmm.
PTSD
PTSD.
from
Yeah.
being in battle. So it's got some like weight behind it.
Mm-hmm.
And I'm just a huge fan of it. And yeah, I see her every month. Oh, and we don't really we don't really go through the sort of opening lots of boxes. Th- as I've said, there are lots of difficult trauma boxes from my past, but
Mm-hmm.
I never feel like it's a chore, going through them and
Mm.
opening them up, because I think when we do open up something, we sort of deal with it and close it off pretty quickly. So it's not like I'm
Mm-hmm.
living with, reliving that trauma again and again and again, which I think some sometimes people think that therapy is a little bit of, you just have to sort of sit with this trauma for a while. But no, it's it's
Mm-hmm.
it's it's just really helping me deal with all of these. And also what I will say about trauma is uh, it's all on different levels, isn't it?
Yeah.
Because a traumatic event to you might be your cat dying, and a traumatic event to me might be my mum dying. It's all different
Mm-hmm.
levels of how it
Yeah,
can
100%.
do.
Yeah, the level of trauma is subjective.
Mm,
It is not, it's never the same for one person because
mm,
we're all built completely differently. And I
yeah,
remember, I think it was probably a meme or a quote or something that I saw on Instagram once, about, the phrase that gets thrown around of we've got so much on our plate. Yes, but everybody's plate is a different size. And some people are born
yeah,
with it. Some people are born being a paper plate. Like some people are a paper plate and some people are a china plate and some people are a IKEA plate. Like everybody is a different plate. So your version of a full plate is completely different to somebody else's, and your ability to keep everything on that plate is different to somebody else's. So trauma is subjective. If it's trauma to you, it's trauma, and that's the end of it.
yeah. That's a really good analogy. That is. So can we? What I'd love to end with is like maybe like one or two sort of coping strategies that
Mm-hmm.
you'd maybe if somebody's feeling a little bit anxious, or maybe they've got like something really scary coming up, like for example, I've got a really scary meeting tomorrow morning, to do with sort of family stuff that I'm quite worked up about. So it's like, is there like a coping strategy that you could recommend, or sort of you have to put yourself into these horrible situations that you have to do, you have no choice of doing?
Yes. So one of the key things that I will tell anybody to do, because it is the most accessible, you'll probably have quite a big amount of resistance to it because your brain won't want to do it, but it's the most accessible, it's the easiest to start making it a habit, is you've just got a journal. You've got a journal. Go and get yourself a notebook and set yourself a timer, 5 to 10 minutes, stream of consciousness. Do not edit yourself. Write everything down. All of the thoughts, all of the feelings that you are currently having. Just do not stop until that timer stops. I personally do it every single day, and I notice when I don't how busy my head gets, because I'm trying to deal with it all inside. You can't deal with it all inside. You've got to get that shit out of your body. You've got to get the energy out of your body. And the easiest way to sometimes do that is by literally just writing it down with a pen and a piece of paper. I tend to also say, yes, there are apps where you can type and you can do it on your computer, but it's not the same. And we spend enough time on our phones and our computers. Don't do it. Do it with a pen and a piece of paper. When it comes to specifically dealing with something that you know you're going to have to deal with, and you are creating scenarios in your head that are probably not going to happen about this thing, which is what we do as humans. We like to create an idea of what we think everything's going to be like. There is an exercise, which I originally heard about this from Tim Ferriss, which is called the fear setting exercise. So again, what you will do with a journal, pen and a piece of paper, is you will let yourself think about the worst case scenario. So you will set the fear expectation. Okay, what is the worst case scenario? What is my biggest fear about this situation going absolutely horribly wrong? What is the worst thing that could possibly happen? And write that down on a piece of paper. And then all you're going to do is you're going to talk to yourself about how you would deal with that situation if that happened. So worst case scenario, everything absolutely goes to shit. Such and such says this is the worst possible. I forget all of the things that I was going to say. I'm unprepared. I'm late. I'm whatever. Write that down. Okay, if that happened, what is the first thing that you would do to rectify the situation or to make yourself feel safe? And you create your coping strategy step by step. Be as specific as you possibly can about every single thing that you would do to bring everything back to normal. Okay, great. Now you've got your plan of what would happen if the worst case scenario happens. How likely on a scale of 1 to 10 is it that worst case scenario is going to happen? A 5, maybe 5, maybe 6, depending on what the situation is going to be. And then think about, okay, what is the most likely scenario? Once you've got all of your crazy out, because we're all crazy, and you've realized that that is probably not going to happen, what is the reality of the situation? How realistic is it that I'm just going to feel certain emotions being in this situation? And it is okay that I am going to feel those emotions. I can let myself feel scared. I can let myself feel anxious. It's totally normal. It's okay. And then how do you want to show up? How do you want to feel? How do you want to present yourself? Because a lot of the thoughts that we create about these scenarios, about other people's perceptions of us, and how other people are going to throw things at us that we're not expecting, how other people are going to behave. It's all about other people and all of the stuff that we cannot control. So the one thing that you can control is how you show up in that meeting. How do you want to feel? How do you want to speak? How do you want to dress? Get super specific. Go as specific as you possibly can so that you can go into that feeling as centered as possible. If you are someone who is open to the idea of breathing techniques, either doing a super quick 5-minute guided meditation before you go to the place. Ideally as close. So for example, with your meeting, I would suggest going to the toilets and do a 5-minute breathing meditation, and then do the power pose. Like stand in the toilet cubicle. No one can see you. No one cares. Do your breathing meditation. Try and get as grounded as you possibly can within those 5 minutes, and then just stand in the power pose. If that's the way that you want to go into the meeting, do that for like 2 minutes and then go in.
Yeah.
You've already prepared your nervous system. This is not like woo-woo spiritual stuff. This is, you need to teach your nervous system that you are safe, because there's no tiger in there that's about to rip your arm off. It's just somebody who's might be a bit of a dick. Like, which feels like a huge scary thing, but your nervous system needs to feel prepared and feel safe and as grounded as you possibly can to go into that, so that you can show up in the way that you want to show up. That's what I'd say.
That's brilliant. That's really, well, thanks for that, for
very
meeting. But we've all got shit that we have to do that we don't want to do, and a lot of the time you can't put it off, particularly when it's to do with your family.
And it's hard. Like, this stuff is hard. I know people on Instagram can sometimes make it look like it's super easy to just change your mindset about things and then everything's going to magically be fine. No, your body, particularly if you have gone through trauma and your nervous system takes over. Like, it overrides everything. So you've just got to do your best to calm down.
Yeah. That's really useful. Cool. Brilliant. That's a really perfect way to end, on a practical, really useful thing for people. So, how do people find you on the internet?
On the socials. Yes.
On the socials, if you want people to find you.
Yeah, I'm most active on Instagram, which is at It's Becca Donovan. I do offer coaching services as well, so you can just contact me through Instagram. To be honest, is probably the best way to get hold of me. Yeah,
brilliant. Thank you ever so much. That was such a fascinating conversation.
I've
so
just forgotten.
open and honest. It's brilliant. It's brilliant.
I do also have my own podcast, which I completely forgot about because I haven't obviously recorded anything over the summer holidays with having the kids and my own personal life chaos. So I have a podcast called Humans in Training, which is available on all the podcast platforms. So if you want to check that out, feel free.
Brilliant. Cool. I'm going to remember that. Yeah, right. Thank you. I'm so pleased that Sammy said we had to meet each other and talk to each other, because I think we're kindred spirits with what we want to do with our lives and help people, and we've been through a few shared experiences.
Yes.
But yeah, thank you ever so much for your time. I really appreciate it, Becca. And everybody, please go follow Becca and benefit from her wonderful tips. And good luck with the training.
Thank you.
Yeah, it's brilliant. Right, thank you ever so much.
Thank you.
We'll stop this, but stay there. Oh, how do I stop it?